Good morning, good afternoon, good evening, wherever you are. In the next few minutes, I'd like to explore the challenges to health communication in low-resource settings as the fourth industrial revolution unfolds. Healthcare delivered digitally at your home, surgeries performed remotely across the world, potential cures for HIV and cancer. As we cross the physical, digital, and biological boundaries to innovate at an ever increasing speed, the fourth industrial revolution has the potential to transform health. So, what are the challenges to health communication in the future? For that, let me invite your attention to this moment. We are in the midst of the COVID-19 pandemic. There have been 6.5 million recorded deaths across the world. Science delivered vaccines, medicines, and tests at an unprecedented speed. And yet, in the third year of the pandemic, over 75% of Africans have not been vaccinated. This pandemic saw unprecedented attacks on science, and this has impacted people's trust in health agencies across the world. Misinformation and disinformation, fueled by people with power and access to huge digital megaphones, reached billions of people at speeds which the scientists and public health experts simply could not match. I remember a communication officer reporting during the pandemic that their channels were overwhelmed by conspiracy theorists. And they wondered if anybody cared about science-based information anymore. The fact is that people still do care about science and seek information from trusted sources like WHO. But during this pandemic, there were moments when it was easy to feel overwhelmed by the hate and disinformation. This pandemic highlights a shift in how people consume health information and who they trust. This is transforming health communication today. In the past, journalists relied on experts for health information, and people got their news from prominent news sources, which were trusted and valued for their credibility. A recent survey conducted in 25 countries revealed that in 2022, more than 50% of adults use social media as their source of news. We live in a world where our economies are creating unhealthy lifestyles. Instead of creating well-being, our economic models are destroying the planet, polluting our air, water, and food, and creating a host of mental health conditions. Policymakers and governance systems across the world seem to be unable to override the interests of powerful lobbies and lobbyists that are harming our planet and our health. These lobbies also wield influence over traditional media and social media. Today, independent news channels are fighting shrinking budgets to uphold journalistic standards. COVID-19 was the first pandemic since the explosion of social media. And without the filter of professional editors of the old days of news, rumors and disinformation spread so fast across social media platforms that WHO created a new category of study called the infodemic. Ladies and gentlemen, this moment in the COVID-19 pandemic gives us a snapshot of the communication challenges of the future. And these challenges are rooted in inequity, ethics, and science literacy. Unless we address these underlying issues, we will repeat the mistakes we have just witnessed. The rich will get access to new innovations, the poor will be left out. We will see this especially amplified in low-resource settings. Mass protests against vaccines and masks highlighted the fact that even in well-resourced settings, our education systems have failed to create science literacy and critical thinking. This has left people vulnerable to rumors and disinformation. I witnessed an anti-mask protest outside the UN offices in Geneva at the height of the pandemic, and I could see that the protesters were passionate about not wearing a mask. disinformation had reached them in a more impactful way than science-based information. Today's health communicator is fighting to grab people's shrinking attention spans. To communicate life-saving information, we find ourselves enslaved to the algorithm. Fear is easy to deliver in bite-sized packages. Creating a nuanced understanding of a complex, fast-evolving situation in less than 30 seconds, not so easy. This reinforced to me that scientists and public health experts must tell impactful stories in languages of the people we serve, on channels they access, and in formats they consume. As the fourth industrial revolution unfolds, remember, the innovations it brings will also be available to the highly motivated, ill-intentioned conspiracy theorist. We can counter this by building science literacy, by enabling the public to sift through the infodemic and identify trusted sources and evidence-based information. The fourth industrial revolution could communicate health information to the parent, to the teenager, the older person much more effectively and enable them to live healthier and happier lives. But first, we must address the issues of inequity and ethics in our world. Otherwise, we will end up with an even more fractured world where technology serves only those who have access and resources.